Because remember, in as much as we do the theoretical training, the hospital, the practicals is part and parcel of training when in medical school. And you start as early as you're in school to do the rotations in the hospital, and also you're placed for a whole year in a very active hospital to be able to practice your expertise better. So yes, we're well trained. As a GP myself, I could say I'm well trained to be able to pick up some of these issues. Some of them are very straightforward. When you talk about hypertension and diabetes, they are straightforward, but others require more expertise, and that's what I said, high index of suspicion to be able to pick up some of these early signs, especially like autoimmune. Autoimmune are very tricky. Today, patient comes with joint pain, tomorrow comes with stomach issues, tomorrow, things that are not ending, and you have to think beyond what you're trained that I might be dealing with something beyond just a stomach issue, a joint issue, and then referral, adequate referral. Refer appropriately so that you don't refer to the wrong specialist, then the patient is delayed with the wrong specialist for a while, then you have to be referred again to another specialist. So I believe the doctors are well trained. I think it's just of resource mobilization just to enhance even the diagnostic. So we don't fully rely on labs. Actually, labs are just a confirmatory mechanism for most of the cases. As we say, when you're trained, 80% of your diagnosis comes from history taking. Me just talking to you, understanding what has been happening, taking your family history. That's why most of the people, when they come to the hospital, samanga tunauliza maswali kama za maternity. Now we're trying to get the history for us to come with the most specific diagnosis, so that even when I'm sending you to the lab, I'm not sending you for unnecessary tests that might not really help me with the diagnosis. And even when we're practicing, you find most of the time the doctor does not start with the lab. They don't start with imaging. We start by questioning, and then we come up with a probable diagnosis according to what you've told me. Then from there, I continue with confirmatory tests, that is lab diagnostic and all that. Yeah.
But you're talking a lot about hypertension and diabetes. So perhaps are these some of the most common chronic illnesses that you're dealing with right now in the country? Because I know you work at Myer Kidney, and I'm wondering, I'm not hearing about kidney much. Is it hypertension and diabetes?
Yeah, because majorly kidney issues and heart issues are not, mostly they're not standalone diagnosis. They're always secondary diagnosis to a primary diagnosis. So the leading NCD right now is hypertension. And you find most of the people, actually less than 15% are aware and are actually taking care of themselves. More than 50% you find they're not aware. It had been mentioned maybe in a visit 1 or 2 that they have hypertension. The second one is diabetes. We have cancer. Right now we're seeing also an issue with psychological issues, that is depression, anxiety is in the high rise. But the leading to majorly diagnosis and hypertension and diabetes, because now without proper monitorings and follow-ups, we now culminate to the kidney issues, because hypertension will lead to kidney issues, diabetes will lead to kidney issues, and also heart issues, stroke, nerve issues, and all that. That's why we're putting a lot of emphasis. That's what the major percentage of these NCDs are, and then the rest will come along. Yeah.
So when should somebody come to these health